You may think that only certain parts of the population receive Medicaid and it only impacts certain people. That is absolutely not true. You need to stay tuned and find out how to protect Medicaid so that it's there when we all need it. People are concerned about Medicaid. They're concerned about a lot of issues, but there have been some major changes to Medicaid that people really need to know about and how they may affect you. And to talk about some of those changes today, we have with us Brian Peters, who is the CEO of the Michigan Health and Hospital Association. And we also have with us Glenn Fuchs from our national office in Washington, D.C. Hi, Brian, and hello, Glenn. Thank you so much for being with us today and talking about this really critical issue, Medicaid. There have been some changes to Medicaid that people may or may not be aware of. So let's start first by just talking about what, on a elevator pitch level, what changes have been made to Medicaid that will impact those who are receiving it.
Paula, thank you so much for having us on today. Indeed, it is a critical issue, frankly, for all Michiganders, and I know we'll get into exactly why that's the case. But to your point, Medicaid is a shared state and federal program, and as a result, we have to pay very close attention not only to the state budget negotiations that are now underway here in Lansing, Michigan, but also what transpires at the federal level in Washington, D.C. And on that end, as you know, H.R. 1, otherwise known as the One Big Beautiful Bill Act, was passed by Congress and signed into law last year by President Trump. We are very concerned about the potential impact on access to care for all Michiganders, but particularly those who are on Medicaid today, both traditional Medicaid and the Medicaid expansion population, because what the big bill actually does is creates new Medicaid work requirements and changes and really turbocharges, if you will, the eligibility verification process, making it much more cumbersome and onerous to those who benefit from Medicaid. And then from a hospital perspective, the big bill actually changes the Medicaid provider tax state-directed payment program. This is a critical mechanism that Michigan hospitals and health systems, which, by the way, employ a very large number of physicians and other providers who care for our families every single day. It changes the way we fund those hospital operations. And we can get into those details, but I can tell you, we have done the analysis at the Michigan Health and Hospital Association. We know it is a very significant hit over the 10-year horizon of that legislation, north of $6 billion in direct funding reductions to hospitals if the legislation is implemented as it's been signed into law. So very, very concerned about what's coming down the tracks in the coming years.
Thank you for that, Brian. Appreciate that. Glenn, what's happening in DC? What's AARP doing to help make certain that people aren't negatively impacted by some of these cuts?
Well, you know, as Brian mentioned, when people hear the term Medicaid cuts, they often think that it's just one simple change. But, you know, really what's happened here is it's a set of policy changes. So we're trying to engage at all of these levels. These are a set of policy changes that are essentially putting more hurdles between people and their health coverage. As Brian mentioned, it's sending less federal money to states. And so states are having to react to those funding shortfalls in a variety of ways. A lot of these changes are going to be playing out over the next few years. So at the federal level, we're trying to make sure it's, as far as definitions, that few people are going to lose coverage as possible. But a lot of these important changes happen at the state level. And so in a state like Michigan, where states are choosing how they're going to implement some of these new changes, like the new work requirements, like the new paperwork rules for people on Medicaid, more frequent eligibility checks. When you stack all those together, fewer people get covered. It's more strain on the healthcare system. So we're really looking to help prevent that as much as possible.
So let's get a little bit more specific in terms of like we talk about the work requirements. Some people may not even know about the work requirements or some of those components of this particular proposed legislation. Talk specifically about how this could impact certain individuals.
Sure. So yeah, just to take a step back, the work requirements, this is one of the biggest changes that's coming soon in Medicaid. So starting in 2027, states that have expanded Medicaid eligibility, there are about 40 of those states, Michigan is one of them, they have to make certain adults, most adults from ages 19 to 64, make them prove every month that they're working or that they're volunteering or that they're earning above a certain amount in order to qualify for and keep their Medicaid coverage. Now, there are some exemptions. If you're a parent with a kid under age 14, if you're pregnant, if you have a disability, the good news is you get an exemption from all of this paperwork. There's also an exemption for family caregivers. And AARP has been pushing at both the state and the federal levels to make sure that the definition that they use for who is a family caregiver is as broad as possible, and to make sure that it's easy for folks to prove that they are a family caregiver so that they get this exemption. Now, on paper, you hear about work requirements and frequent eligibility checks. It may sound reasonable, but in practice, what happens is often it causes coverage losses because of paperwork problems, not even because people fail to meet the rules. So most people on Medicaid are already working. We know that. Some of them are family caregivers or they have health limitations. And so the challenge becomes reporting. People move. They might miss the mail. The forms get confusing. We all know that. Online systems can be confusing and may not be accessible to everybody. So the estimates are that these rules could cause 5 to 6 million people to lose Medicaid coverage nationally. And most of that is because of the paperwork, the red tape, not because they don't qualify. And when coverage is cut, people don't always land somewhere else. They may not realize they qualify for other types of coverage, or they may find it unaffordable. So they end up falling through the cracks and losing their coverage. So this is definitely something to look out for coming in 2027. If you fall into one of those categories in Medicaid, you're going to need to show soon that you're working or that you're volunteering or that you qualify for one of those exemptions.
Wow. Brian, do you want to add to that?
Glenn said it very well. I would just say that in Michigan, the analysis is very clear that between 170,000 and 350,000 Michiganders could potentially lose coverage through this new public policy. And, you know, the concern is if you think about how user-friendly the system may or may not be. Amazon famously has created a very easy, user-friendly way for all of us to make online purchases. If we have something akin to that process so that those who should qualify for coverage can easily document their ability to access Medicaid, excuse me, that would be one thing. The concern is that we don't go down that path and have something that is cumbersome, something that is awkward for people to utilize, and then we see coverage loss as a direct result. The other thing I would lift up is the fact that many people won't think about going through these steps until they have an illness, an injury that requires them to head directly to a hospital emergency department. In other words, they're not thinking about going through these steps as a matter of course when they are perfectly healthy and don't need healthcare access today. But we know how healthcare works, and we know that it's critically important that people have that coverage beforehand so that we don't go down this rabbit hole.
Absolutely. You know, some people think that Medicaid is just for a certain population of people, but there are some implications for those on Medicare as well. So want to talk about that a little bit, please?
Well, there absolutely is. And as I alluded to earlier in my comments, this policy change could potentially affect all 10 million Michiganders, including everyone on Medicare. And I'll say that because when a hospital has to curtail or eliminate an entire service line, and we have seen that in our state over time, or when a hospital has to close its doors entirely. And we have closed over 100 hospitals in Michigan in the last 40 years. To set a context, this is not just pie in the sky. This is reality. When those things happen, it is not just those with Medicaid coverage who lose access to those services. It is everyone in the community, regardless of what insurance card they have in their purse or their wallet. And so you're exactly right, Paula. It's a major concern for all Michiganders.
And does it impact rural Michigan even more than other parts? Because I mean, they're already having challenges with access to health care. So
there's no question about that. Rural Michigan, just like rural parts of the country throughout our great nation, are older, sicker, and poorer. That's what the data tells us. And so the percentage of individuals on Medicaid tends to be larger. The margins are slimmer. It becomes more and more difficult to recruit and retain physicians and other providers in rural areas, partly because of low volumes. But whether we live and work in those rural communities or whether we're traveling through that community or on vacation with family in those communities, you never know when we're going to need healthcare access. And we need that to be there for us. We need high quality healthcare to be there for all of us. And yes, rural communities are particularly at risk.
AARP, we consider ourselves, or we are, and I just consider ourselves a wise friend, fierce defender of all things that impact people who are 50 and older. This is certainly one of those issues. So what can people do? I mean, is this, you said 2027, in my mind, that's like tomorrow. That's just how I think. It's like there's a sense of urgency about this in Paula's mind anyway, but we have a short window of time between 2027 and now. What can people do?
Well, I think first is to stay connected. If you're on Medicaid, make sure that your contact information is up to date with Medicaid and to watch for those renewal notices or notices about work requirements, anything like that. Second, rely on trusted sources like state agencies, like your local providers and hospitals that are going to have more information, and establish groups like AARP. Third, I think, is share your experience. As Brian mentioned, the state is really grappling with a lot of these issues right now with the budget and how they're going to implement it. Share your experience, these personal stories about how much Medicaid means to you and your loved ones and your family maintaining their health coverage. They really do help decision makers understand the real world impacts. I mean, our goal at AARP is to make sure the changes don't leave people without care or push families into these impossible choices where they're, deciding whether or not to seek health care or to pay for other bills. So I think staying informed about these changes and engaged is really the first step.
Absolutely agree. And in terms of that engagement, we live by the mantra that politics is not a spectator sport. Everyone who has a stake in the outcome needs to be engaged. And we have a mechanism to do that at the Michigan Health and Hospital Association, at our website, mha.org. Very easy to navigate and find our Advocacy Action Center, where you can simply plug in your home address and it will populate with your state representative, your state senator, your federal elected officials. You can author a letter to those individuals. You can reach out with talking points and really share your story. As Glenn well said, stories and data, that's what carries the day. Numbers are important because they set a context, but nothing is more impactful, nothing can move the needle like stories about how public policies that are on the cusp of being implemented or have been implemented are actually affecting individual lives. And we need to tell those stories early and often.
It's my understanding, thank you for that. It's my understanding that the Governor Whitmer was making a pledge to try to help bridge the gap that Medicaid is going to leave, but that in itself, is going to also result in more of a deficit in the budget in some other area. Can you talk about that a little bit? Because people think, well, you're just going to move money from one place to another place and bridge the gap, but it doesn't work that way.
Right. There is a legitimate hole in the budget this year. The good news is the governor, who has been a great healthcare champion from her first day in office, has once again prioritized all of our issues in the budget, the things that we believe are necessary so that hospitals have the means to deliver access to high quality care in every Michigan community. That's the good news. The bad news, as you alluded to, there is a hole in the budget that needs to be filled. She's proposed filling that with some new taxes. We would be part of that process and hopefully have a good outcome at the end of the day. But, politics is the art of the possible. And sometimes there will be countervailing forces that say, these increases are not politically palatable. We need to look at another mechanism. And I'm sure we'll have that give and take throughout the course of this year. Now, remember, this is an election year. There's going to be a lot of pressure for our elected officials to wrap up the state budget and get on the campaign trail before the primary season. Certainly over the course of summer, that would be their desire. But let's remember, last year, 2025, the House and Senate and the governor were here in Lansing right through the end of September, negotiating that state budget that technically started on October 1st. And so, it's not clear at this point what the timing is going to be of bringing this to fruition, nor what the outcome will be. But again, it's back to our prior point. We need to make sure our voice is heard in that process.
So for the people who are strong advocates, and that should be everybody, whether you are 50, 60, or 15, that should be everyone who's an advocate for continuing with Medicaid. If I ran into one of our members of Congress in the grocery store, specifically, what would I ask them regarding this? What's the talking point? Glenn, maybe we could talk about it from a federal level, and then Brian, you could talk about it from a state level. What's the ask?
Well, I think the ask is to protect Medicaid. To protect Medicaid as a program. I think people often don't understand how far-reaching Medicaid is as a program. It's not just about healthcare. There's long-term care as well. That people benefit from through the Medicaid program.
At the state level, the message is very clear. We need to protect Medicaid, and we need to protect Medicaid because it's the right thing to do, first and foremost for the people who rely on it for their access to care. But secondarily, we need to protect Medicaid because it is important to Michigan's economy. Why do I say that? Because what is often lost in this conversation about health policy and Medicaid in particular is the fact that if individuals are not healthy, they can't work. They can't contribute to our economy. So Medicaid work requirements, while we understand the rationale, you have to turn that on its head a bit and understand that first and foremost, we need people to maintain their health status. They need to be healthy in order to show up for the job and work. So we absolutely need to protect Medicaid. From an economic perspective and from a wellness perspective, it is the right thing to do.
Thank you for that.
And I'll mention also that, these issues that Michigan is facing right now, this is not just unique to Michigan. These are being faced by states across the country. As they're being faced with the budget cuts, they have to decide whether or not they're going to cut services or reduce payments to healthcare providers. Or find state dollars to fill the gap. And again, we see Michigan potentially taking some good steps to help fill that gap, but there are going to be aspects where the impact is going to be felt no matter what. And what raises concern for AARP is how these changes actually play out in real life. So for real people, they're not going to suddenly become ineligible for Medicaid overnight, but instead they're going to get tangled up in this new paperwork. They're going to miss a letter. And so that's some of the messages that they can bring to their state legislators is we need to make this process as smooth as possible, as consumer friendly as possible, so fewer and fewer people fall between the cracks.
That's right. And the reality is this conversation is not occurring in a vacuum. We have the issue of the enhanced premium tax credits, which expired at the end of 2025. And even today have not been renewed or extended by Congress, despite some efforts to do so. And then you have to look at the change in the MA space, the Medicare Advantage plans, and all that's going on there in terms of the funding and the policy around MA. So our elected officials have a lot at stake here in terms of the future of health policy. And all of these different components work together in the healthcare ecosystem. Once again, it speaks to the necessity for all of us to make our voice heard in this conversation.
Absolutely. And those of you who are watching this program, please share this information with other people. Make certain that you don't just ask someone, are they supportive of Medicaid, but exactly what they're going to do. How can they make certain that you are protected? Lift your voice. Your voice matters. You hear it over and over again. Tell your story, tell your story, tell your story. Brian and Glenn, thank you so much for being here with us today. People are going to be hearing a lot more about this issue because it's such a critical issue, and now is the time to act on it. Thank you so much.
Thank you.
Thanks, Paula, and thanks for all of the work you and your team are doing in Michigan.
We appreciate you. We're partners. We're working together on this. Thank you.
If you don't have a will, what are the risks?
Well, I think it's important to know the state already has a plan in place for you if you don't have a will.
Oh,
So it's important that you take the time to understand what that plan is and then define for yourself what you would rather have happen.
we don't want the state planning what happens to our money. So what are the options?
Typically not. A will is a set of instructions for the probate court to follow. So that's how you declare to the state what you want to happen to real assets like your home, real property. A trust would be taking the control out of the probate court and leaving it directly to your heirs.
Can people create a trust on their own, or do they need to seek a financial advisor?
Absolutely an attorney.
You need an attorney in order to create a trust.
Correct.
And then that has to be filed and submitted.
Trusts do not get filed. Trusts are private documents that avoid probate. A will is filed as a matter of public record.
And can you change, or should you look at changing your will every year, or is it once you have one, it's good forever unless you have some changes you want to make?
Documents created last as long as you need them to. Most folks, most clients, most individuals, their goals change, their lives change. Kids mature, kids change, they get
Grandchildren,
divorced,
yeah.
grandchildren. So every period of time, you should consider changing or updating your wishes to be pertinent to where things are at today.
So regardless, bottom line, it's important to have a plan, and to have a plan that can be easily executed.
And is directly in correlation to what is most important to you.
And communicate that, right?
Absolutely. Where is the will located?
Yes, yeah. Thank you so much. Great advice. Transportation. Everybody needs to know about transportation. And to talk about that, we have Geneva with us today, who is a member of the Local Advisory Council for CATA. Thank you so much for being with us.
Well, thank you for having me.
So tell us about CATA and about your CATA journey and how you utilize their services.
I utilize their services every day. They take me to work. If I have a doctor's appointment, they take me to my doctor's appointment, and I appreciate it. And the drivers are all very nice with my granny cart, as I call it. If it's heavy, then they'll take it into my apartment building for me and ask me, make sure, you sure you can do this by yourself? And I tell them yes, and I appreciate them. I've been using them, I think, for like 4 years now.
Very nice.
And I'm grateful to have the opportunity that there is someone out there that can take me, now that I'm a senior, to places I need to go.
That's a good thing, being a senior. You should celebrate that, right?
Yes.
And are they on time? Are they punctual? And how did you start using them?
A friend told me about them, because I really, no, let me take that back. My daughter, when she was alive, because she was a paraplegic, she used CATA.
Okay.
And then later on, after she passed, a friend told me, well, why are you taking the big bus when you don't have to do that? And I'm like, what are you talking about? And so she told me about them, and I got an application, filled it out, and they called me, and I went in, and I was approved.
Fantastic. That's wonderful. And it's so nice that that kind of service is available for people in our community. Thank you for sharing your story with us, Geneva.
Well, thank you for having me.
Hi, I'm Tracy Anderson with Impart Alliance. Today I'm joined by Bethany Deiser, who oversees the training program at Impart Alliance and also serves as our Associate Director. Bethany, could you tell us a little bit about the training program opportunities within Impart Alliance?
Sure. We have a free training program for direct care workers. Any direct care worker in Michigan is eligible to participate, or any future potential direct care worker. So if this is a career you're considering, one that you're newly starting out in, or one that you've been doing for a while and want to learn more about, we have training options that will suit your needs.
Tell me a little bit about what people will experience in the training program.
So our training program is virtual hybrid. So some of our classes are delivered through an online classroom platform like Zoom. And some of our classes are in person and include hands-on skills performance. All of our trainings are done live. So they're led by an instructor who knows this material, who has experience working as a direct care worker, and knows how to deliver our standardized competency-based curriculum to direct care worker students. So it's a fun classroom type style, and there's something for everyone.
Tell me why this is important.
Because direct care work is an important healthcare job. I've been a nurse my whole career, and one of my most formative experiences was going to nursing school as a young lady. And I think everyone working in healthcare really requires that competency-based, expert-led education in the theory and the skills of doing your job correctly.
Great. Thank you so much, Bethany.
Of course.
So you want to avoid a nursing home and you need long-term care. David, what are the options?
Okay, I'm so glad you asked that question. It's like we didn't even discuss this before. Nobody wants to see their spouse in a nursing home. Nobody wants to be in a nursing home. At least I don't know anybody who does. And the beauty thing is that you've already paid for the program of all-inclusive care for the elderly, PACE. PACE is our favorite program of all time because it does what you want it to do. It provides the level of care, the assistance to the spouse, to the family, so that no nursing home. 95% of PACE recipients die at home. These are people who otherwise, without PACE, they would be in assisted living, they'd be in a skilled nursing facility. But it doesn't have to be that way. And it is the good results are it's just overwhelming, because what we see so often is when a spouse finally has to give up and admit that their spouse needs skilled care, it's devastating to the at-home spouse. Everything they did, now it's terrible.
How expensive is PACE?
Oh, PACE is free. PACE, you already paid for it. It's part of your FICA. Came out of every check you ever received. Okay, it's a Medicaid case, so we got to qualify for Medicaid. But now they'll pick your spouse up to 5 days a week. They'll do light housekeeping. During the COVID, they even did grocery shopping to keep you at home, which is where most people, frankly, want to be. And they could do it if they had that much help. That's what PACE is there for. We love PACE.
We need PACE all over the state of Michigan. Thank you, David.
Thank you.
Please don't wait till 2027 to start talking about Medicaid. Talk to your elected officials today about how to protect and preserve Medicaid. Thanks for watching Real Possibilities.